What is osteoporosis? Causes, risk factors, prevention, and treatment. Osteoporosis, commonly referred to as the silent disease, is a medical condition characterized by reduced bone density and strength. This makes bones fragile and more prone to fractures, even from minor injuries or falls. Often, people are unaware they have osteoporosis until a fracture occurs, which can significantly impact their quality of life. Understanding the risk factors, prevention methods, and treatment options is crucial in managing this condition effectively. Causes of osteoporosis. Osteoporosis occurs when the body loses too much bone, makes too little bone, or both. Throughout life, bones are constantly being broken down and rebuilt in a process called bone remodeling. However, with age, the rate of bone breakdown often exceeds the rate of bone formation. Several factors contribute to the development of osteoporosis. 1. Calcium deficiency. Calcium is a vital mineral for bone health. Insufficient calcium intake over time can lead to reduced bone density and early bone loss. 2. Hormonal changes. In women, estrogen plays a critical role in maintaining bone density. After menopause, estrogen levels drop significantly, leading to rapid bone loss. In men, low levels of testosterone can also contribute to osteoporosis. 3. Vitamin D deficiency. Vitamin D is essential for calcium absorption. A deficiency can lead to weaker bones and an increased risk of fractures. 4. Lifestyle factors. A sedentary lifestyle or lack of weight-bearing exercises can weaken bones over time. Smoking and excessive alcohol consumption are also linked to decreased bone density. 5. Medical conditions and medications. Certain chronic conditions, e.g. rheumatoid arthritis, hypothyroidism, and medications, e.g. corticosteroids, can accelerate bone loss. Risk factors for osteoporosis. While osteoporosis can affect anyone, some people are at higher risk. The most common risk factors include 1. Age. As we age, bone density naturally decreases. The risk of osteoporosis rises significantly after the age of 50. 2. Gender. Women are more prone to osteoporosis than men due to smaller bone structures and the hormonal changes associated with menopause. 3. Genetics. A family history of osteoporosis or fractures increases the likelihood of developing the condition. 4. Ethnicity. People of Caucasian and Asian descent have a higher risk of osteoporosis compared to other ethnic groups. 5. Body type. Individuals with smaller, thinner frames are more susceptible due to having less bone mass to lose. How to prevent osteoporosis. While certain risk factors, such as age and genetics, cannot be controlled, there are many steps one can take to reduce the risk of developing osteoporosis. 1. Nutrition. Increase calcium intake. Adults require about 1,000 to 200 milligrams of calcium daily. Foods rich in calcium include dairy products, milk, yogurt, cheese, leafy green vegetables, spinach, kale, almonds, tofu, and fortified foods. Vitamin D. Vitamin D helps the body absorb calcium. Sun exposure, fatty fish, salmon, mackerel, egg yolks, and fortified foods are good sources. In some cases, supplements may be necessary. 2. Regular exercise. Weight-bearing exercises. Activities like walking, dancing, or hiking help maintain bone density. Strength training. Resistance exercises, such as lifting weights, strengthen muscles and bones. Balance and flexibility training. Yoga or Tai Chi can improve coordination and reduce the risk of falls. 3. Lifestyle changes. Quit smoking. Smoking reduces bone mass and affects calcium absorption. Limit alcohol consumption. Excessive drinking interferes with the body's ability to absorb calcium and vitamin D. 4. Prevent falls. Use non-slip rugs, adequate lighting, and sturdy handrails at home. Avoid walking on slippery surfaces. Wear supportive, non-slip footwear. Who is most at risk for osteoporosis? Osteoporosis predominantly affects older women, particularly those who have gone through menopause. However, men, younger individuals with certain medical conditions, or those on long-term medications like corticosteroids can also develop the disease. People with the following characteristics are most at risk. Postmenopausal women. Hormonal changes post-menopause lead to accelerated bone loss. Individuals with eating disorders. Conditions like anorexia or bulimia deprive the body of essential nutrients. Patients on long-term medication. Steroids, anti-epileptics, and certain cancer treatments can weaken bones over time. People with chronic illnesses, conditions like diabetes, lupus, or kidney disease can increase susceptibility. Treatment options for osteoporosis. While osteoporosis cannot always be cured, several treatments are available to slow its progression, improve bone density, and reduce the risk of fractures. 1. Medications. Bisphosphonates. These drugs, e.g. alendronate, risdronate, are the most commonly prescribed for osteoporosis. They slow bone breakdown and increase bone density. Hormone therapy. Estrogen therapy can help postmenopausal women maintain bone density. However, it may carry risks and is usually considered for younger women with severe bone loss. Denosumab. This injectable medication works by inhibiting bone resorption. Parathyroid hormone analogues, such as teriparatide, these stimulate bone formation and are used for severe osteoporosis. Romosozumab, a newer medication that helps both build bone and slow breakdown. 2. Calcium and vitamin D supplements. Supplements may be recommended to ensure adequate intake of these essential nutrients. 3. Physical therapy. A physical therapist can design a tailored exercise plan to strengthen bones and improve balance, reducing fall risk. 4. Surgical interventions. In cases of severe fractures, surgical options like vertebroplasty, stabilizing fractured vertebrae, or hip replacements may be necessary. Living with osteoporosis. Osteoporosis requires lifelong management, but many people with the condition can lead active, fulfilling lives. Key steps include regular checkups and bone density scans to monitor progression, adhering to prescribed medications and supplements, staying physically active to maintain strength and flexibility. By addressing osteoporosis proactively, individuals can significantly reduce the risk of fractures and maintain a high quality of life.